Hello everyone, I am Dr. Kartheek, Orthopedic Surgeon at Care Hospital's Malakpet branch. Today we will discuss about the foot deformities in the old age. These type of foot deformities develop in the old age, which are usually like deviation of the toes to one side, called as hallux valgus. Sometimes entire toes are deformed to the one side, called as windswept deformities or hammer toes. Even though these are common in old age in all the patients, these are more common in rheumatoid arthritis patients. In rheumatoid arthritis patients, these are specifically common in those who are having severe rheumatoid arthritis. So these patients will be under constant medication under the rheumatologist. And as these deformities develop over a course of time, like taking 5 to 10 years usually, the patient might think that these are part and parcel of the aging and might neglect that there is nothing to do with these deformities. So it's better to consult an orthopedic surgeon whenever they notice such deformities, so that they can get proper evaluated and they can have the treatment. These deformities are need to be corrected because they might make the patient lose the balance whenever they are walking on a slippery surface or watery surface, and they might sustain falls. So it's better whenever they notice the change in their shape of their feet to get consulted with an orthopedic doctor and evaluated further, so that they can get a surgery done. Now with the recent surgeries, this can be corrected on a daycare basis and they can be discharged on the same day, and they can walk with the help of splints from the day one. Thank you.